is Mary with nursing. I am getting ready to do the exam physical. I am going to show you, show the room as requested. Okay. Hi, Lyric. Hi. Okay, hi, how are you? Let me know if you have any problems during the physical and we will discontinue. So I'm going to start with your hair. Okay, I don't see any infestations. I don't see any lesions in your scalp. Looks clean. It looks appropriate. Your hair is distributed appropriately. Now I'm going to be checking. I'm going to be checking your head. Okay. I don't feel any lesions. I don't feel any abnormalities. The head is normal. Looks normal cephalic. Okay, then we're moving on to your face. Skin is is within normal. It's normal. It has no lesions. It has no abnormalities. Color is appropriate. Eyebrows is appropriate, distributed appropriately. Eyelashes look appropriate. There doesn't seem to be any problems at all with your skin or your eyelashes or eyebrows. If you can open your eyes, I'm just going to look at your conjunctiva. Okay. Okay. Looks good. So I'm going to test cranial nerve 1. Cranial nerve 1 is smell. Close your eyes and tell me what that smells like.
Vinegar.
Okay.
Peppermint.
Okay. Great. Okay. So we're going to move on. And we've tested cranial nerve 1. That was smell. Cranial nerve number 2 is vision. And we usually test that by Snellen, the Snellen test, which is a vision test, or the Rosenbaum test, which is a vision test as well. Snellen test is 20/20. The norm is 20/20. What it does is the top number, you have to stand 20 feet, which is a numerator. Usually you stand 20 feet. It's represented by the numerator, which is 20. And then if you stand, you read to whatever line you read clearly, that's the line. So if you read to line 10, it'd be 20/10. If you read line 30, it'd be 20/30. Okay, so, and then we're going to move on and we're going to discuss Rosenbaum test. This test is where you, the norm for it is 14/14. And when you're sitting, if you wear reading glasses, you have to remember to wear your glasses when you're doing this test as well. The norm for it is 14/14. So that is the vision for cranial nerve 2. Cranial nerve 3, 4, and 6 is tested by eye movements. And we will also, while we're testing that, I'm going to be looking at your structure. I'm going to be looking at your pupil. I'm going to be checking for red reflex. So we're going to kind of do all that one in one. Okay?
I understand.
All right, great. So first I'm going to do is I'm going to look at your pupil. So open your eyes. Okay, the other one. Okay, your pupil looks fine. Let me just check out, just look at your eye. Okay. All right, so that looks good. So what I'm going to do now is I'm going to cut off the light so I can check you for red reflex. Look at me. Look at me. Okay. Okay. Let me check again. Hello. Okay. Red reflex is there. Your pupil looks normal. Your eyeball, your eyes look clear. I see a little bit of veins in the area. Redness is probably due, as I said before, probably due to some allergies. But I could see, it looks within normal limits. Okay. Okay, so that was 3, 4. 3, 4, and 6. So I'm going to test your field of gaze. Six fields of gaze. I'm sorry. I want you to cover one eye, and I want you to follow. When it comes, sit up straight, please. I want you to follow. Only when it, look at me. Only when it comes into you'll feel where you can see it, okay?
Okay.
Okay, so. Okay. Cover your other eye. Okay. Seems like you have a little bit of stigmas, but we know that you have that. So we just tested 3, 4, and 6. So the next we will be testing is cranial nerve 5, and what cranial nerve 5 tests is your facial sensation. Okay. So I want you to close your eyes and tell me when you feel sharp or when you feel, tell me if it feels sharp or if it feels soft, okay?
Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft. Soft.
Again?
Soft.
Okay. Good. So we tested cranial nerve 5. So we're going to be testing cranial nerve 7, which is facial expression. So I want you to puff out your cheeks. Okay. I want you to smile big. I want you to frown. I want you to purse your lips. Okay. Stick your tongue in your cheek. Stick your tongue in your other cheek. Okay, great. So we just tested cranial nerve 7. So now we're going to be testing cranial nerve 8. I want you to sit up straight. I'm going to be whispering to you, and you tell me what you hear.
Blue sky. Yellow casket. Yellow cat.
Yellow, right, exactly. Okay. So we just tested cranial nerve 8. We're moving on to cranial nerve 9 and 10. Cranial nerve 9 and 10, I will be testing your vagal response first. Well, no, I'm going to test, open your mouth please. I'm going to test your gag response. Open your mouth wide, wide. So I'm going to test gag and vagal together. Open your mouth. Okay. Okay, say ah.
Aww.
Okay, good. Great. Okay. So, cranial nerve 9 and 10 were tested together. So if you can open your mouth for me, please. I just want to look at your teeth. Open your mouth wide as I can see your teeth. Okay. And I'm going to be looking, I want to test the patency of your nose. Can you put your finger right here? Now sniff. Good. Now put your finger, sniff. Okay, great. Now I'm going to look in your nose. Okay, great. Wait. So, do you feel anything? Are you able to breathe okay? Okay, wonderful. I don't see any drainage. I don't see any mucus. I don't see any drainage or mucus from your eyes. Great. So I just, cranial nerve 9 and 10 was tested. I tested your gag reflex when I looked in your mouth, and I tested your vagal response by having you say ah. So now we're moving on to cranial nerve 11. So I need you to shrug your shoulders. I'm going to try to push. Okay, great. I can't push now. I want you to push your face against my a hand. So, okay, the other way. The other way. So I tested your cranial nerve 11. I'm moving on to cranial nerve 12. Now what I need you to do is I need you to take your tongue and move it. I'm testing the hypoglossal. So look at that and look at other side. Try it again. All the way. Okay. Okay. That was a test for cranial nerve 12. So I am now complete with that. So I'm going to now take a look at I'm going to look into your ears. Okay. Okay. Great. I'm looking into your ears. I see your tympanic membrane. Okay. Wonderful. Okay. So I'm going to be looking, I'm feeling for your glands. Okay. All right, I'm looking at your neck, your glands. Okay. So now I'm going to, I need to get, can you turn so I can, okay. So I want you to swallow. Swallow for me. I'm testing your thyroid. Can you please swallow? Okay, good. Your thyroid moves fine. I don't feel any swelling. Okay. Okay. I'm going to listen to your thyroid as well because I'm listening to see if you have a bruit. I'm also listening to your carotid artery. Okay. No bruise heard. Okay, so I'm moving on now. I've tested your neck. So what I'm going to do now is your ears are within normal. I tested both ears. I need to, at this point, I need to test. I just kind of want to take a look at your skin just to see how your skin looks. You have a little bit of discoloration on your arms, but that's due to a healed rash that you had. Can you pull your pants leg up, please? Pull pants leg up. Okay, can you pull your shirt up a little bit so I can look at your stomach? No, you can lay down if you want to. I'm just kind of taking a look at your skin. I'm just looking at your skin. I'm just looking at your skin. Okay. Your skin all looks good and healthy. I don't see any problems with your skin. There's a little bit of a rash there, but you're fine. So you can sit back up. You can sit back up at this point in time. Okay, so now I'm going to do a lung and a thoracic exam on you, and I'm going to be checking your cardiac area, cardiac as well while I do this, okay? Okay, so first thing first with this is I'm just going to palpate, and I'm going to start with checking your lungs. So if you turn around, pull your hair back. Okay. So I'm going to listen to your lungs. Okay. Okay. Take a deep breath. 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 Okay. So what I'm going to do now is I want you to say 99, okay?
99. 99. 99.
Okay. Lift your shirt up for me, please, just a little. Okay. Now, I'm going to be checking, okay, if you can turn around. I'm going to be checking expansion. Okay. Can you turn around a little bit? Okay. All right. Take a deep breath. Okay. Take a deep breath and hold it. Now, release. Okay. All right. So at this point, I'm going to be checking. Okay, your lungs sound fine. I'm going to be listening to your thoracic area. Take a deep breath. Take a deep breath. Take a deep breath. Take a deep breath. Okay. All right. So that seems fine. Okay, so now I'm going to be moving on. I'm going to be checking your heart. Okay, so I need for you to okay, that's good. Okay, so now I am going to be checking your pulses. Okay, so if you can lay down. Okay, so I'm going to check your radial pulse. I'm going to check all your pulses. Okay. And there's no threading or anything abnormal. Pulses feel strong and appropriate. Okay, so let me adjust so he can see. I'm adjusting so you can see I'm checking both pulses on each foot. I'm checking popliteal pulse. Okay. We're going to forego the femoral pulse at this point. So I'm going to move on. I'm going to do your abdominal check at this point. If you can, first I'm going to oscillate. Okay, you have positive bowel sounds. Then I'm going to palpate. Oh. Does that hurt?
No.
Okay. So now I'm going to checking for liver. I'm feeling for your spleen, kidneys, liver, I can't feel anything. Does anything hurt? Okay, wonderful. Okay, so we're going to be moving on now. And I am going to, we've done the abdominal check. I oscillated, I palpated, I examined your abdominal. So the next thing I'm going to do is the musculoskeletal. So if you can raise your leg up. Okay, extend. Okay, bring your leg out. Then bring it back toward me. Towards you. Then bring the other leg up. Then bring it back up towards you. Then extend. Now point your feet in. Now cross your leg like a guy will cross his legs. The other one. Okay. Now I want you to lift your leg up and then try to push against my hand. Okay. I'm going to try to stop you. Okay, the other one. And I'm going to try to stop you. Okay. Okay. Okay, point your feet back up. Point your feet down. Okay. All right. So if you can stand up, please. Okay. So hold your hands out. Hold your arm out. Okay. I'm going to try to push down. Now turn your hand over. I'm going to try to push down. Hold your fingers outward. Okay, I'm going to try to push them together. Don't let me. Okay. Now hold your fingers together. I'm going to try to pull them apart. Okay. I can't. Okay, at this point. Okay. Okay. Now, I want you to walk. Heel toe, heel toe. Okay, turn around. Okay. Now if you can bend over and bend over. And I'm going to check your spine. I'm checking you for scoliosis. Okay. Okay, everything looks appropriate. Okay, so if you can back up. All right. Now what I need for you to do is put your fingers together like this. Okay. Like this. Each one together. Up. Each one together. Okay, and let me see. Like this. Okay. There's no clubbing. Now hold your hands out for me again. Okay, great. Okay, shrug your shoulders. Shrug your shoulders. Okay, do your neck. Twist your neck. I'm checking for range of motion. Okay, wonderful. Oh, I'm sorry. Let's do this again. Shrug your shoulders. Okay, turn your neck. Turn your neck. I'm checking for range of motion. Okay, at this point, I'm going to, we've done that. You've pointed your toes. Okay, lay back down. Okay, I need to adjust the camera. Okay, so put your legs straight. Okay, hold them tight. I'm going to try to pull them apart. Okay, wonderful. Trying to pull them apart. Okay, you can relax. I couldn't pull them apart. Okay, at this point, what I'm going to do is I'm going to check your nails. I'm looking for color. Okay, let me see that one. Okay. Capillary refill is less than 3, so that's good. Checking your toes for capillary refill. It's less than 3. Okay. Okay, I've checked your pulses. Okay. You have strong pulse. Now we've done your musculoskeleton. We've done your abdominal. We've done your thoracic, and we've done your cranial nerves. I am just looking at your skin. So the next thing I want you to do is you can sit up for this part of it. The next thing I want you to do, we've done your skin. We've checked your skin. We've checked your nails. Skin is all good. There's small There's a small discoloration due to a rash, but everything is within normal limits. At this point, we're going to move on and we're going to check. I'm going to give you some items and I want you to tell me what they are, because I want you to hold them and then I want you to tell me what they are, okay? So, let me see. Okay, close your eyes. Okay, tell me what this is. Hold it. Close. What is it?
Sanitizer?
Yes, it's a bottle of sanitizer. Okay, the next thing I'm going to give you now I want you to tell me what this is. Keep your eyes closed.
Comb.
It's a comb. Exactly. So the next thing I'm going to do is I'm going to trace a letter or a number in your hand and I want you to tell me what it is.
N.
Okay.
O.
Okay. Alright. So what I'm going to do is I'm going to use a pen to trace that letter in your hand. Or letter or number. I'm going to do a letter.
W.
Okay. Alright, wonderful. And the next thing I'm going to do is I am going to check I've checked you. You've gotten both of those right. Graphesthesia and sternosis, I think. I may be pronouncing this wrong, but I've checked both of those, and you have done that. You have passed. So now, I'm going to. I would check your reflexes, but I don't have my reflex hammer, which I apologize for. But if I was going to check your reflexes, I would check them with your elbows bent here and here. I would check your patella here and here. And those would be the ones that I would check. So, okay, that's it for my physical exam. Thank you.